Safety Lesson 6 covers protective shielding and barriers. The third cardinal principle of radiation protection. Shielding applies to both personal protective equipment and the structural barriers of your imaging rooms. Understanding how shielding works, what the specifications are, and how to maintain and use protective equipment correctly is tested on the registry and critical in daily practice. 12 minutes. 2 fundamental concepts that underlie all shielding design. The half-value layer, HVL, the thickness of a material that reduces beam intensity by exactly 50%. After 1 HVL, 50% of the beam remains. After 2 HVL, 25%. After 10 HVL, less than 0.1%. HVL depends on the material and beam energy. Higher, KVP means higher HVL because the beam is harder to stop. The 10th value layer, TVL, the thickness that reduces the beam to 10% of its original intensity. TVL equals 3.32 times the HVL. Used for structural shielding design calculations. Primary radiation is the useful beam, unattenuated and requiring the heaviest shielding. Secondary radiation includes scatter from the patient, approximately 1/1000th the primary beam at 90 degrees, and leakage from the tube housing, limited by regulation to 100 mAh at 1 meter. Secondary barriers require less shielding than primary. The lead apron is the primary personal protective equipment for any radiographer working near scatter radiation. Standard specification: 0.5 millimeters lead equivalent. This reduces scatter by approximately 90 to 95%. A lighter 0.25 millimeter option exists, but provides less protection and is appropriate only for lower scatter environments. Lead aprons do not protect from the primary X-ray beam. They are designed for scatter only. The most important maintenance rule: never fold a lead apron. Folding cracks the lead lining and eliminates protection in that area. Always hang aprons upright on a dedicated rack. Annual inspection is required. Fluoroscopic or radiographic imaging of the apron identifies cracks as dark spots. Defective aprons must be immediately removed from service. Typical service life: 5 to 10 years with proper care. 3 additional protective items, each with specific requirements. Thyroid collar, 0.5 millimeters lead equivalent. Required during all fluoroscopy portable and C-arm work. Reduces thyroid dose by more than 90%. The colloquial rule: if you put on the apron, you put on the collar. Lead glasses, 0.35 to 0.75 millimeters lead equivalent. The NCRP lowered the occupational lens threshold for cataract formation from 2 gray to 0.5 gray. That is a 4-fold reduction. All workers performing repeated fluoroscopy should wear lead glasses. Protective gloves, 0.25 millimeters lead equivalent. Appropriate for holding patients or cassettes in scatter fields. Never place in the primary beam. A 0.25 millimeter glove provides minimal protection against the primary beam and creates a dangerous false sense of security. Gonadal shielding protects reproductive organs from scatter, preventing genetic effects in future generations. Use Gonadal shielding when the patient is of reproductive age. Gonads are within 5 centimeters of the primary beam edge. And shielding will not obscure anatomy critical to the diagnosis. Do not use Gonadal shielding when the gonads are the region of clinical interest. Shielding would obscure anatomy needed for diagnosis, or when AEC is active and the shield might fall over a detector chamber. The AEC would overexpose to compensate. Note: the ACR and American Association of Physicists in Medicine issued guidance in 2020 and 2021 recommending reevaluation of routine gonadal shielding protocols in digital imaging. Institutional policies vary. Know the clinical rationale. The ARRT still tests it. Structural shielding in X-ray rooms is categorized into primary and secondary barriers. Primary barriers stop the useful X-ray beam directly. Required wherever the primary beam can be directed. Minimum 1 Mars 16-inch, approximately 1.6 millimeters, of lead in the wall, or equivalent concrete. Primary barriers extend from the floor to 7 feet high. Secondary barriers stop scatter and leakage, not the primary beam. Required on all unshielded surfaces, ceiling, secondary walls. Since scatter is approximately 1/1000th the primary beam intensity, secondary barriers require less shielding. Minimum, approximately 132-inch lead equivalent. The control booth wall is always a secondary barrier. The leaded glass window, 1.5 to 2.0 millimeters, lead equivalent. Shielding design calculations must be performed by a qualified medical physicist based on workload, use factor, and occupancy factor. Never guess. The control booth protects the radiographer during every exposure. The wall is a permanent secondary barrier. The leaded glass window allows full patient visibility. An intercom is required. You must be able to communicate without leaving the booth. The door or curtain must be closed during every exposure. Mobile lead barriers, L-stands, are essential for portable radiography in the OR, ICU, and patient rooms. Typically, 2 millimeters lead equivalent in leaded acrylic. Position the barrier between yourself and the tube. Stand at maximum cord extension, minimum 6 feet from the tube head. Use the barrier in distance, not one or the other. For portable exposures, announce before every exposure. Stand at maximum cord length. Step behind a barrier or around a wall corner. Wear lead apron and thyroid collar. Position yourself at 90 degrees to the primary beam. Scatter is lowest there. Portable radiography outside a shielded room is the highest risk setting for occupational exposure in diagnostic imaging. You have no structural barriers, no control booth, and often minimal space. 6 rules for every portable and OR case. Announce the exposure, X-ray, step back, and give everyone time to clear. Stand at full cord extension, minimum 6 feet from the tube. Position yourself 90 degrees from the primary beam. Use a mobile lead barrier whenever one is available. Wear your lead apron and thyroid collar. No exceptions. Never hold the patient. Use positioning aids. If someone must hold the patient, use a non-pregnant adult with full PPE and document it as an occupational exposure event. 2 components to shielding quality assurance: personal protective equipment, annual fluoroscopic or radiographic inspection of all lead aprons, thyroid collars, and gloves. Defects appear as dark spots in the fluoroscopic view. Remove defective equipment immediately. Document inspection date, inspector, findings, and action. Structural shielding, initial survey by a qualified medical physicist at installation. Resurvey after any renovation or equipment change. Radiation survey with a calibrated ionization chamber. Dose rates in all adjacent areas are measured and compared to regulatory limits. All survey results are documented and retained by the radiation safety officer. Any structural defect, cracks, holes, unshielded penetrations, must be repaired before clinical use resumes. 3 shielding questions in the ARRT style. The answer is C. Remove the apron from service and replace it. A dark spot identified on fluoroscopic inspection represents a crack or void in the lead lining, a loss of shielding integrity in that area. There is no acceptable level of lead apron defect. Remove it from service, document the finding and disposal date, and replace it immediately. The answer is C. Stand at maximum cord distance, angled 90 degrees from the beam, wearing full PPE. Without a mobile barrier, distance and beam angle are your primary protections. 90 degrees from the primary beam is where scatter intensity is minimal. Combined with maximum cord distance and a lead apron plus thyroid collar, this provides the best achievable protection. The answer is C. 2.5 millimeters aluminum equivalent. The NCRP requires minimum total filtration of 2.5 millimeters aluminum equivalent for diagnostic X-ray tubes operating above 70 kVp. This total includes inherent filtration from the tube itself, typically 0.5 to 1.0 millimeters, plus added filtration at the tube port. Adequate filtration removes low-energy photons that add only patient skin dose. You covered HVL and TVL, lead apron specifications and care, thyroid collar, and lead glasses with the updated NCRP lens threshold, Gonadal shielding, primary and secondary structural barriers, portable work protection, and shielding quality assurance. Keep drilling.